This is a podcast story. You don't need to watch, just listen. Keep driving, keep working, keep living. This story will stay with you. You're lying on an operating table. The surgeon cuts into you. You feel it. You feel everything. But you can't move. You can't scream. You're trapped inside your own body. This is anesthesia awareness, and it's real. Welcome to Untold Mind. Thank you for being here. For the next 20 minutes, I'm going to tell you a story that will change how you think about surgery. October 1998. Carol Weihrer is 44 years old. She's a chemist, a mother, a rational scientific person. She's scheduled for eye surgery, a procedure to remove scar tissue from a previous operation. It's supposed to be routine, low risk, in and out. She arrives at the hospital in Milwaukee. She changes into the surgical gown. She's wheeled into the operating room. The anesthesiologist introduces himself. He inserts an IV. He says, "Count backward from 10. Carol starts counting. 10, 9, 8. And then nothing. Blackness. She's unconscious. The surgery can begin, except she's not unconscious. Carol is paralyzed but awake, fully, horrifyingly awake. She realizes what's happening slowly. First, she notices she can hear. The surgeon is talking, the nurses are moving around, instruments are clinking. She thinks, why can I hear them? Shouldn't I be asleep? Then she feels it, pressure on her eye, then pain, sharp, searing pain. The surgeon is cutting into her cornea. She feels the blade. She feels every millimeter of the incision. She tries to scream. Nothing happens. Her vocal cords are paralyzed. She tries to move her hand. Nothing. Her entire body is frozen. She tries to open her eyes wider to signal distress. Nothing. The paralytic drug has locked her muscles completely. Carol realizes, I'm awake. They don't know I'm awake, and there's nothing I can do about it. She starts screaming internally. In her mind, she's shrieking, stop! I'm awake! I can feel everything, but outside her body lies perfectly still. To everyone in the operating room, she looks peacefully unconscious. The surgery continues. Now, before I tell you what happens next, and I promise this gets even more intense, I want to ask you something. If you're finding this story compelling, if you're already gripped by this medical nightmare, do me a favor. Hit that like button. It really helps more people discover these important medical stories. I appreciate it. Thank you. Carol is trapped. Time moves impossibly slowly. Every second feels like an hour. She feels the surgeon manipulating her eye. She feels stitches being placed. She feels instruments scraping tissue. The pain is excruciating, but she can't even flinch. She tries to focus on anything else. She tries to mentally escape, but the pain keeps dragging her back. She thinks about her children. She wonders if she's going to die. She wonders if anyone will ever know what happened to her. The surgery lasts 90 minutes. For Carol, it feels like days. Finally, it's over. The surgeon steps back. The nurses start cleaning up. But Carol is still paralyzed, still unable to move or speak. She lies there waiting for the drugs to wear off, terrified that they never will. Slowly, sensation returns. First her fingers twitch, then her toes. Then she can move her arm. Then, finally, she opens her eyes. A nurse leans over her. How are you feeling? Carol croaks. I was awake. I felt everything. The nurse smiles. Oh, that's just the anesthesia talking. You're confused. It's normal. No, Carol says. I was awake. I heard everything. I felt everything. The nurse pats her hand. That's impossible. You were under anesthesia. Carol starts crying. She's not confused. She knows what happened, but no one believes her. This is common with anesthesia awareness. Patients wake up after surgery and report, I was conscious. I felt pain. And medical staff dismiss it as confusion, dreams, or hallucination. But anesthesia awareness is real. It happens in approximately 1 out of every 1,000 surgeries. That means thousands of people every year experience what Carol experienced, and most of them are told that didn't happen. So what goes wrong? Anesthesia involves multiple drugs. A paralytic drug that stops muscle movement, a sedative that makes you unconscious, an amnesiac that prevents memory formation, a painkiller that blocks pain signals. In anesthesia awareness, the paralytic works perfectly. But the sedative fails, either because of equipment malfunction, human error, or individual patient variation. You're paralyzed but conscious. And often, the painkiller isn't strong enough to block the agony of surgery. Anesthesiologists monitor patients during surgery using multiple devices: heart rate, blood pressure, oxygen levels. But none of these reliably detect consciousness. A paralyzed but conscious patient might have a normal heart rate. There's no machine that can read your mind and determine this person is awake and screaming inside. Some hospitals now use brainwave monitors, devices that detect consciousness by measuring electrical activity, but they're not universally used, and they're not perfect. Carol Weihrer developed severe PTSD from her experience. She had nightmares, panic attacks. She couldn't close her eyes without seeing the operating room lights. She became terrified of doctors. The trauma was so severe that it affected her for years, and she's not alone. Quick question. Are you listening to this while you're driving, while you're working, maybe doing dishes or folding laundry? That's exactly what this channel is for. Every week I bring you medical stories, survival stories, things that sound impossible but actually happened. And you can listen to all of them while you're living your life. No need to sit and watch. Just listen. If that sounds good to you, hit that subscribe button. New story every week. All right, back to Carol. Carol wasn't the first, and she won't be the last. A woman in Massachusetts woke up during C-section. She felt the surgeon cutting through her abdomen. She felt them pulling her baby out. She screamed silently for 20 minutes. A man in Texas woke up during heart surgery. He felt his chest being cut open. He felt the surgeon's hands inside his body. He thought he was dying. The experience was so traumatic that he committed suicide 2 years later. A teenage girl in the UK woke up during brain surgery. She was conscious while surgeons operated on her exposed brain. She survived physically, but developed severe psychological trauma. These aren't rare, isolated cases. Studies estimate 1 in 1,000 surgeries involve some form of awareness. In the United States alone, that's 40,000 cases per year. Most patients don't report it because they're told they're confused. Of those who do report it, 70% develop PTSD. After Carol's experience, she became an advocate. She founded the Anesthesia Awareness Campaign. She collected testimonies from hundreds of survivors. She pushed for better monitoring equipment. She testified before medical boards. She discovered something disturbing. Hospitals and anesthesiologists often don't report cases of awareness. Why? Legal liability. If a patient says, "I was awake during surgery and felt everything," that's a potential malpractice lawsuit. So many hospitals pressure patients not to file complaints. They offer settlements with non-disclosure agreements. Carol refused to be silenced. She went public. She appeared on TV, she wrote articles, she spoke at medical conferences. Anesthesiologists were initially hostile. They felt attacked. But gradually the medical community started listening. In 2008, the Joint Commission, the organization that accredits American hospitals, issued new guidelines. Hospitals were required to inform patients about the risk of awareness before surgery, use depth of anesthesia monitors when possible, have protocols for responding to reports of awareness, and provide psychological support for affected patients. It was a small victory, but it was something. Today, anesthesia awareness is more widely recognized. Medical students learn about it. Anesthesiologists take it seriously. Brain monitors are more common, but it still happens. Every day, somewhere in the world, someone is lying on an operating table, paralyzed, screaming internally, feeling everything. Carol's advocacy saved lives. By speaking out, she forced the medical establishment to acknowledge a problem they'd been ignoring for decades. But the psychological cost to her was enormous. Reliving her trauma repeatedly to help others took a toll. She suffered from depression. She had recurring nightmares, but she kept fighting because she didn't want anyone else to experience what she experienced and then be told it didn't happen. If you're listening to this and you're scheduled for surgery, don't panic. Anesthesia awareness is rare. 1 in 1,000 is a small risk. Modern anesthesia is remarkably safe, but you should know it exists. You should ask your anesthesiologist, what do you do to prevent awareness? You should know that brain monitors exist and can request one if you're high risk. And if you wake up after surgery and you remember being conscious, don't let anyone tell you it was a dream. Don't let anyone dismiss your experience. Demand that your report be documented. Seek psychological help if you need it. Carol Weichrer's story teaches us medical systems don't fix themselves. Change happens when patients speak up, when they refuse to be silenced, when they demand better. Thank you for spending these 20 minutes with Carol's story. If this opened your eyes to a medical risk you didn't know existed, do me one more favor. Share this with someone, especially anyone facing surgery soon. Send it to your mom who's getting her hip replaced. Send it to your friend who's scheduled for that procedure. Because knowledge is power, and people deserve to know. This is Untold Mind. Every week, a new story you can listen to while you're living your life. No need to watch, just listen. Until next time, stay informed, stay listening.